Joanne Zeiss was a healthy woman in her 20s when she began experiencing strange symptoms. For 17 years, she lives in agonizing pain while she seeks out a cure for the nameless disease before it takes her sight.
Went to bed the night before and my vision was 20/20. And I woke up the next morning and it's blind.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Zeiss was 22 when she began experiencing the terrifying symptoms that would stay with her for the next 17 years. It all started when Joanne began seeing things.
I was standing outside with a bunch of my friends, and I remember looking up and I saw what looked like a flock of birds just flying around up in the sky. I looked at my friends and I said, "Why are those birds always up there?" And they all looked at me and nobody said anything, and so I knew then that something was wrong.
She had thought she had seen birds, but she realized there weren't any. And I think that was pretty scary for her. She felt like she was seeing things.
Joanne works as a graphic artist, and any problem with her vision could have devastating consequences. She wastes no time making an appointment with an optometrist.
Told me that I had something called floaters in my eye, and that they're little pieces of debris that break off from the edges of your retina and just float around. Go home and forget about it. So that's what I did.
Joanne gets used to seeing the specks floating in her field of vision, but a year later, the floaters are accompanied by intense pain.
Well, I walked outside and it was a bright sunny day, and I noticed that my eye hurt immediately as soon as I looked towards the light. When I came home and I looked in the mirror, I saw a red ring around the colored part of my eye, and if I looked very closely, I could see that there were tiny little blood vessels that were showing in that red ring. I panicked.
The doctor notices Joanne's iris is red and swollen and prescribes steroid drops to reduce the inflammation. But a few weeks later, they aren't helping. What's more, Joanne's vision is getting blurry and starting to affect her work.
Joanne mentioned the waviness when she was reading as a major problem.
It literally was like looking through a layer of cheesecloth.
Joanne rushes back to the hospital, where she's referred to a specialist, Dr. Stephen Foster.
Joanne had already lost some vision in the left eye when I first saw her. Joanne had uveitis, or inflammation inside the eye that was affecting her vision, and she was referred to me because of that.
Uveitis is an inflammation inside the eye. There are 4 types. The mild forms affect the front structures of the eye, but in the most severe cases, the inflammation damages retinal blood vessels in the back of the eye.
If it affects structures that are truly critical for good vision, like the retina or the optic nerve, it will blind a person.
Fortunately, Joanne has a mild form of uveitis, and her retina has not been affected. Dr. Foster prescribes more steroid drops and puts her on a strong anti-inflammatory drug. The effects are hit or miss.
The next few years were a progression of taking the pills, using steroid eye drops, and having things go away, and then it would recur again every 4 to 6 weeks. It was like clockwork.
Joanne probably saw a doctor twice, 3 times, sometimes 4 times a month.
But because Joanne is changing jobs throughout this period, her health insurance plan is also changing, and she finds it difficult to stay with one doctor. Each new doctor who examines Joanne prescribes a new course of treatment.
One of the doctors sat me down and he suggested giving me steroid injections behind my eye. He said that this would put the medication directly in the area of my eye that needed the treatment. The first thing that ran through my head was, no way, you're not coming anywhere near me with a needle.
1 week later, Joanne receives her first steroid injection.
Every aspect of her was braced up for this.
Just the thought of it, I can't imagine what that must have been like.
The doctor told me to lie back on the table and that I needed to stare up and try not to look at him as he's coming towards me with the needle. And I remember not feeling so much pain as an incredible amount of pressure. and the amount of pressure was almost unbearable.
To Joanne's disappointment, the one injection has little effect, so the doctors prescribe a series of shots over the next 12 months. But after a year, Joanne's vision remains blurry, and her eye begins to throb with pain.
I was actually pretty frightened at this point because I had no idea what the whole thing was going to lead to.
She was concerned that she might lose her sight. It must be devastating.
Joanne goes back on anti-inflammatory pills, and her vision eventually stabilizes. Then, a few months later, she is struck with odd new symptoms.
One morning I woke up and I went to go stand up, and as soon as my feet hit the floor, I just felt this awful pain through both of my ankles. The first thing that ran through my mind was, what next? I already have eye problems. Now I've got this. I must be the unluckiest person in the world.
Joanne Zeiss has experienced blurred vision and mysterious pain in her eye. One morning, the joint pain is so excruciating that Joanne can barely get out of bed.
I just figured I was walking around too much at work. I was doing too much climbing. I was being too active. I was having pain in my shoulders. I was having pain in my hands.
At first, Joanne forces herself to work through the pain.
Joanne's not the kind of person who'll be, oh, my hand hurts, oh, my arm hurts, oh, I'm so tired, I can't do this today. She's not sitting there, pity me, pity me. It was just, this is what's happening, I have to deal with it. And she just moves on with things.
But when the pain becomes too unbearable, Joanne seeks out help. Her doctor suspects she's having a bad reaction to the anti-inflammatory she's taking for her eye problems. He prescribes a new drug, often used for arthritis. It works.
I was amazed that my joints all seemed to feel almost normal again, and I didn't have the pain in my ankles and in my hands the way I'd had for quite a while. So life was good again.
But just as Joanne begins feeling better, she is stricken with yet another excruciating symptom.
All of a sudden, I started getting sores in my mouth. It wasn't like the regular old canker sores that would be gone in 3 or 4 days. These would get red and raised up. It would all of a sudden just kind of break open and become an ulcer, and it hurt a lot.
I remember for quite a while, Joanne had to drink milkshakes because she couldn't chew.
I had to drink through a straw because that was the only way I could get the liquid down past the ulcers that were in the front of my mouth without having it hurt too much.
They were in her whole mouth, her tongue, the insides of her mouth, the roof of her mouth.
Terrified that she may have herpes, Joanne makes an appointment with her dermatologist.
He took a look in my mouth and he said, what you have right now is herpetiform ulcers. And I said, well, does that mean I have herpes? And he said, no, it's just the medical term for a whole bunch of ulcers in one small area. And I just breathed this big sigh of relief.
Doctors think ulcers can be caused by many things: stress, acidic foods, an immune reaction. There's no cure, and they must be allowed to run their course. The dermatologist prescribes some medication for the pain so that Joanne can eat. But as the ulcers come and go, Joanne begins to notice odd skin problems on other parts of her body.
I started getting these small, clear lesions on my hands and on my ankles. You know, you'd want to scratch it, but as soon as you touched it, you'd just be in agony. So I went in to go see a doctor again.
The doctor tells Joanne it's most likely an allergic reaction, maybe to her laundry soap, and not to worry. But Joanne is worried. It's now been 8 years of escalating symptoms. First her eyes, then her joints, then ulcers, and now lesions.
I was going through so many different types of symptoms that I really was kind of in shock. I couldn't believe that any one person could have all these strange things happening to them.
But Joanne hasn't stayed with any one doctor long enough for him to be able to see the big picture. She is terrified that not having one consistent physician is causing things to slip through the cracks.
I was very frustrated at the number of doctors that I had to see. I think I'd seen 6 primary care doctors, an unknown number of ophthalmologists for my eyes. So I felt like I was spinning my wheels over the years and that I really was getting nowhere.